Okay, the fallout continues over President Biden's sweeping plan to force as many as 100 million Americans in the workplace to take the COVID-19 vaccine or lose their jobs. Republican governors in a number of states have vowed to push back against the president. Lawsuits are being filed, and healthcare workers are resigning. And what the president announced last Thursday night is only the tip of the iceberg. During an interview on This Week with George Stephanopoulos, the U.S. Surgeon General, Dr. Vivek Murthy, was asked about mandates for 12 to 17-year-olds, and he made clear that the Biden administration will have a bit more up their sleeve.
Well, George, I think if you look at the substance of what the president announced, there's a tremendous amount in there and a lot of very aggressive actions that will help us increase the number of people who are vaccinated, protect those who are sick, and ultimately get us through this pandemic. We will always be looking for more measures that we can take, George, and that's as it should be.
Joining me now to talk about all this and more is Congressman Dr. Greg Murphy. He is still an active practicing physician and a member in good standing of the North Carolina Institute of Medicine. He represents the 3rd Congressional District of North Carolina, and he also serves on the House Education and Labor Committee. Congressman Murphy, welcome back to the program.
Hey, Tony. Good afternoon.
Well, let's start with first, I want to get your reaction as a physician to this mandate of the president.
Yeah, Tony, I've been very clear since the very beginning of this that I believed in the science. I read the literature, and I feel that getting vaccinated is the thing as a physician I would recommend. But I do that because I'm a physician. The fact that the Biden administration has felt that government needs to intercede between a doctor and their patient is blatantly wrong. It should not happen. And my remarks about that are they should be encouraging people to go see their doctor and discuss this with them. And, the other point is it's one thing to be vaccinated. It's another thing to be immune. And there are a lot of folks that have natural immunity. So instead of asking, am I vaccinated? They should be asking, are you immune? And that's going to be a real problem because, the Biden administration is destroying our economy as it is. And now we're going to have people that, because of religious beliefs, because of other beliefs, are simply not going to take the vaccine and rather walk off the job. And it's just the wrong way to approach this entire pandemic. I understand that we want to get people vaccinated. And I understand that most people in the ICUs right now are the unvaccinated. Those are facts. I will not refute those by any means. I was just in our ICU, our level 1 trauma center that has 900 beds. I walked through that just this time last week, and I understand that. But you also have to understand that people have rights, they have religious rights, and the federal government is in no place to stomp on those. So that's where I am with mandates.
Well, I'm actually with you on that because I am not anti-vaccination. In fact, I've encouraged people who are in high-risk categories to get it. But you asked the right question. We should be asking the question, who has immunity, whether it is natural or whether it's through a vaccine. And the CDC, Dr. Fauci, in fact, Dr. Fauci was asked over the weekend about natural immunity. He said, I really hadn't thought about that. It should be a factor. In fact, if I look at the numbers, just since the president made this sweeping mandate on Thursday, it appears that the number of people getting vaccinated is declining. Because, if you're telling somebody to do something and there's all of this political stuff swirling around it, people can say, wait a minute, I'm not so sure about that.
Yeah, Tony, I saw patients this morning. I still, practice a couple days a month because I love it. I love my patients. I think they appreciate it. And my first question is, did you get the shots? And, here's the one a lie that the left is producing, that only one segment, only one political party or something is not getting vaccinated. Let me tell you, every demographic are people who, for some reason or another, are reluctant to get vaccinated. So I sat down and I basically said, okay, well, tell me about it. What do you not understand? What do you feel like you could learn about further? I'm not going to tell you what to do, but as a physician, and that's not my job as a physician, it's not to tell people what to do, it's to educate them. Hence, the word doctor really means to teach. And so that's what I do. I teach them about this. And I would say, a good 75, 80% of those individuals, once we've had a candid conversation, doctor to patient, will go on to get vaccinated.
My daughter is an ER nurse, works with the COVID patients, and I actually have a conversation with her almost every day she comes home. Just ask her, what's it look like? What's the volume? What are you seeing? One concern I have, Congressman Murphy, and I'm sure you share this, unintended consequences of policies that emanate from Washington, D.C. Already we're seeing this in the medical field where medical personnel are resigning because they're being forced to take this vaccine. Some are concerned, younger people concerned about the impact it could have on reproduction, different studies that have yet to be fully fleshed out. Already, as I mentioned, there was a hospital in upstate New York that's temporarily had to stop delivering babies because so many nurses have resigned. Are you concerned that we might see other unintended consequences from this mandate?
I'm definitely concerned, Tony. And to speak to that about staff not getting vaccinated and willing literally to lose their jobs, and I've tried to again educate folks, and I've spoken with a lot of the young nurses, oftentimes female, in some of the units in the hospital, some in the offices, and they've addressed the concern about fertility. And I've pointed them to several studies. I've pointed them to the OBGYN societies, the several different ones that they've looked at the science, and they feel like the science really refutes any of the other things about fertility, and I believe it's safe for them. But there are unintended consequences. And to be honest with you, Tony, this is one of the things, I haven't been in politics my entire life. It's been, I think, 5.5 years now. Been a surgeon my whole life. My job is to look at things somewhat objectively, not emotionally, and understand what happens this way, but what the consequences of those actions, what's secondary, what's tertiary, what's a quaternary consequence of this action as we move forward. Unfortunately, I believe folks on the other side tend to make decisions based upon emotion. It makes them feel good. It satisfies a craving. And then all of a sudden, the second consequence occurred and the third consequence occurred. And it's like, oh no, how do I put out the fire once I've already started it? And that's something they have to consider. Our institution did put a deadline for mandating a vaccine December 1st. And I pray this surge is gone by then. And I pray there's actually some give and take between the institutions. We can't lose all our nurses. The number one reason we can't staff beds in the country right now is because we don't have enough nurses. And so there has to be a discussion. Right. An open, honest, and fair discussion between what the needs of the country are and what the needs of the individual are. And unfortunately, this administration, I'll just say this very bluntly, doesn't give a damn about what the needs of the individual. They only care about the bigger picture and their power and their control.
Well, what you're talking about, Dr. Murphy, is having a conversation, treating the American people like adults, which the Democratic Party has a hard time in doing because they have this paternalistic view that they know better than everybody else walking around this country. And you know what? I think people are sick and tired of that. They want to be treated like adults. Now, if there are some in this country that can't take care of themselves, then so be it, but don't treat us all that same way.
Yeah, I agree completely. It's a very, as you pointed out in a very good word, paternalistic. I know better for you than what you know about you for you yourself. And that's not the basis on which this nation was founded. It was based on rugged individualism. We have to understand we are a country. We are 50 united states, but we also, more importantly, are individuals who have individual rights, desires, and beliefs.
Very quickly, Congressman Murphy, I know as a member of the Labor Committee, it's OSHA is going to be the enforcement arm of this in the private sector. Are you concerned that this is an overreach of executive power using OSHA to go into the workplace to force these private companies?
Yeah, it definitely is. And even Biden and his staff, and then they said this earlier, questions the constitutionality of it. For some reason, they don't believe that the Constitution is really noteworthy or we should really pay attention to it. There are going to be several different states, I know, where the labor commissioners or the Secretary of Labor are going to say, no, we're not enforcing this. North Carolina may very well be one of those also, where I live. And so it's a totally onerous burden to place upon the labor departments, to place upon businesses, and we're going to turn into one worker snitching on another worker. Is that what we want in this country? That's what happened in 1930s Germany. That's not what we want in this country.
Well, we're going to be watching this very, very carefully. Again, not anti-vaccine. I think those in high-risk categories, absolutely. should talk to their physicians, and if the physician recommends it, they should get it. But there are a lot of us that have natural immunity. We should be having a conversation about that and not forcing everybody to get the government's vaccine.
Yeah, definitely. And one thing, Tony, I'm not there for the under 16 population. I'm just not there. The studies have not shown it yet. And if they're going to come in and the secretary or the Surgeon General is going to start pushing that, well, he's going to hear something from the other doctors that are equally just as, in my opinion, smart about this topic as he is.
Well, show me the science and I'll follow it. Dr. Greg
That's
Murphy,
right.
thanks so much for being with us.
All right. God bless. Thank you, Tony.